District. Representative, thank you so much for joining us.
Well, thank you, Sylvia. I'm really glad to be here.
We are glad you're here. We have a lot of questions. Now, you have a medical background as a nurse, and you worked with the Health and Human Services during the Obama administration. Let me just get your personal reaction. Are you alarmed by what we are seeing right now?
Well, we know that there's a lot that we don't know about the coronavirus. We are learning more every day about the nature of the disease as we see more and more community spread around the country and around the globe. And we're learning more about how to keep communities like ours safe. And so I am certainly paying attention to the trusted healthcare sources like the Centers for Disease Control and Prevention as they make their daily updates to the American people.
What kind of role can Congress actually play in helping to combat this epidemic?
Well, the Congress has taken an immediate step, which is to approve that $8.3 billion supplemental funding package, which goes to support local public health officials like we have all across the state of Illinois, and make sure that we have the robust capabilities locally to take care of our communities. That is a critical first step. But we also have seen some significant economic impact of the coronavirus here in the United States, and so we are considering additional measures that we can take to make sure that our communities are able to continue to move forward during this time of, great concern to many.
Now, there has been some criticism over the Trump administration because people saying that they don't seem to be taking this seriously. The vice president is the one who's been appointed. He's the head. As a nurse, as a citizen, do you feel that this criticism is proper?
You know what? What I'm focused on is making sure that we are spreading the messages that are critical public health messages to help all the families throughout my congressional district in Northern Illinois understand how they can keep themselves safe and healthy. We know that politics will happen eventually, but I am really focused on making sure that we are leading an appropriate public health response.
I'm curious, too, to get your response to the media's reaction. We've gotten a lot of criticism ourselves, but we feel like we're reporting what the health department people are telling us, the CDC, and our lawmakers. How do you feel about how this is being presented to the general public?
Yeah, well, I respect journalists so much, ma'am, and I have to tell you that I've relied on open source media to get a lot of our information too. We've had the opportunity to be briefed by the Vice President, by the Centers for Disease Control and Prevention Director, by the Secretary of Health and Human Services, and so many others throughout the federal government. But what I can tell you is most of the information they share with us as members of Congress is basically what we could hear from open source media. And so you all do incredible work, and I'm grateful for your excellent job in keeping all of us so well informed.
Well, thank you for saying that. In the 30 seconds we have left, if you can leave people at home with any message, what is that?
So the way to keep you and your family safe are some basic fundamentals like washing your hands thoroughly for 20 seconds. So singing that birthday song or your favorite chorus to your favorite song is going to be incredibly important. Coughing and sneezing into your elbow. Sanitizing frequently touched surfaces, and most importantly, staying home if you're feeling sick. We are trying to limit community spread of this infectious illness, and it takes all of us, our continued vigilance, to make sure that that happens. Be well, everybody.
Yes, it is a team effort, and so simple if we can do those things. Thank you so much for your thoughts on this. We appreciate you joining us for our special today.
Well, thank you, Sylvia. I appreciate it.